Looking for care?
Just establishing a hospital and making it profitable, and a college and making it profitable is a smaller aim. So if you aimed at something that you can achieve in your own lifetime, that is called a smaller aim. Our aim should never be small.
CARE has the first team that conducted an angioplasty in India. First team to develop the coronary stent, Kalam Raju, in Asia. One of the first teams to perform the cardiac MRI in the country. It has pioneering surgical treatment of difficult-to-treat epilepsy in this part of the world. One of the first to treat rhythmic disorder, treatment for holes in the heart. First hospital to launch telemedicine services linking district hospitals. And yes, we are also the first to put patient interest above our own.
I was asking myself, what do you learn from Care Hospital? I asked myself. I learned very simple thing. Learn to serve and learn silence.
It's a fantastic journey. There's no doubt about it. It started in 1997, June, July. Before that, we were together, most of our core group. Not only we two, but others in the core group also. For 11 years. It's basically because of the hard work that was produced by all of our team members. We won the credibility and trust of the patients. The patients came to us, even from the first day. Of course, large proportion of patients that were coming to this hospital were coming to Dr. Samraj right from the beginning.
Myself and my colleagues, whoever is in CARE now, we started at different places, but most of us came together at Nizam's Institute. Many of us were in search of a platform where medicine can be practiced at its best. So, medicine required patient-centeredness, patient care. We need to have medical education. We need to have research. So, to make all this possible, we need a right platform.
That is the vision we started with, and that is the mission we continue to pursue with passion. CARE offers highest quality healthcare at lowest cost, accessible to all, practicing medicine as it should be.
I'm on Raju Kalam Stent, and this is excellent. I have no problem about it. I undergone very recently, about a few months back, an angiogram done after 1997, and I did my angiogram done in 2012, and I found everything is all right.
Quality we look at in two dimensions. I mean, what the patient experiences and what we give in a medical quality. When I say medical quality, are we giving a safe medical care? Because that is the first dictum of medicine, do no harm. so our services are safe. The second is what are the outcomes. If somebody comes with a heart attack, somebody is coming for a bypass surgery, somebody coming for a gallbladder surgery, what are the clinical outcomes? I mean, that is the most objective measure of quality. Now, that is a benchmark internationally, are you there or not there? Because this patient will not appreciate the medical outcomes, patient will not accept. What he appreciates is only the experience he and his family has from entry to exit.
What took off as a 100-bedded single-specialty heart institute facility focusing on cardiac care in Nampalli, Hyderabad, today is a group of multi-specialty hospital chains across India. Expanding footprints abroad.
I've been associated with Care Hospitals from day one of its operations. This journey over the last 1.5 decades has been a long, mutually beneficial and rewarding journey. Our greatest achievement in these few years has been that we were able to imbibe and instill amongst our team members the spirit of service and teamwork, two values that have been very dear to our Chairman and Managing Director, Dr. B. Somraju.
I started my practice in 1992 with a very small nursing home at Budhapara, Raipur, and it was a 30-bedded small nursing home where we just had simple surgical specialties like general surgery, minimal access, urosurgery and neurosurgery and orthopedic surgery. And in 2007, May 10th, we joined hand with Care Group of Hospitals. And after that, we have not looked back, we have moved forward. And today, it's almost from a 70-bedded small hospital, secondary care level hospital, it has now converted into a multi-specialty, super specialty, tertiary care hospital where right from head to toe you can get your treatment done.
All this was possible due to a coordinated team approach and intense research-based culture right from inception. Most of our key doctors hail from academic institutions. This credible blend of academic and professional excellence, teamwork and coordinated approach enables us to have an in-house cardiologist 24/7.
In our hospital, the cardiologists who are qualified are available around the clock, 24/7. So at any time in the night, also dead of night, if somebody comes here for primary angioplasty, the cardiologist is available. Our team of cardiologists are dedicated. You almost come at any time, you will find almost all of the cardiologists in-house. Except in emergency, only one cardiologist is available.
So we are all interacting with each other. Cardiothoracic departments of all 14 care hospitals are interacting with each other on the social web, and we have started to provide a database common to all of us, wherein we present our results. And we, as a team, wherever there is a need, we help each other. That is the most important aspect. I don't mind going to Bhubaneswar and helping them. They don't mind coming over here to help us. So we've got a healthy, mutually beneficial working environment among cardiothoracic surgeons in the entire care group of hospitals, which is very, very unique and good.
Our vision to evolve as a unique academic medical center-based healthcare center has borne results. We have succeeded in inculcating a culture of continuous knowledge sharing, education and learning. This sparks off intellectual challenge among professionals and helps retain the best talent. An incomparable culture exclusive to CARE.
The Department of Vascular Surgery at CARE Hospital is at par with any international department. We provide all modalities of treatment and treat various types of diseases which are not treated in ordinary departments. We cater to all types of vascular problems and provide medical, surgical and interventional treatment. We were the first to start endovenous laser therapy for varicose veins in Hyderabad.
I have been associated with CARE hospitals for the past 13 years. And what we like about this place is the professional freedom which we get. We have the latest neuronavigation with cranial and spinal applications, which accurately helps us in pinpointing the lesions and giving the best possible outcomes to the patients. We have the latest microscope for neurosurgical procedures and also the CUSA machine, which gives us, which helps us in doing a total excision of the lesions without causing any extra deficits to the patients. As far as spinal surgery is concerned, we are performing all sorts of minimally invasive spinal surgeries, including the percutaneous endoscopic lumbar discectomies, where we are doing disc surgeries, lumbar disc surgeries and cervical disc surgeries as daycare procedures and trying to discharge the patients maximum by the same day evening or the next day morning.
The nephrology department at CARE has a full-fledged dialysis unit which runs 24/7. We cover emergencies and acute dialysis, chronic dialysis and continuous renal replacement therapy. Continuous renal replacement therapy is done in only few centers in the country, so one of our center has continuous renal replacement therapies. And then we have acute dialysis for severely ill patients where we do dialysis in the ICUs also. That's how we score over others where dialysis is done in the ICUs. It's full-fledged with nephrologists working all the time, and we have completed almost about 500 renal transplants and our success rate is about 95% success rate. And we do all live related deceased donor transplant, that is cadaver transplant, and even spousal, and we have done the swab transplant that's first in the southern India.
Technological advancements aside, we continue to be a leader in the industry for personal approach we take with every patient.
When you say care, it takes care and takes care of you very well. I've had a number of occasions to go there. The latest was about 6 months ago when I had my femur had fractured, and general care was very good, and particularly the nurses there I found. The doctors of course are very good. I wanted to write to the chairman that these nurses have been very good, extra care.
We nurture a new generation of professionals with lifelong commitment, dedication, knowledge, skills, wisdom, and values.
We don't run behind numbers. What is important is the quality of service which we provide and how good that person has been and how good his contribution has been to the overall growth of the institute. Nobody cares how many cases you have done or how many angioplasties you have done, how many stents you have put. If you have probably refused to put stents in a patient who didn't require it, nobody questions. But if you have put an unnecessary stent, then definitely there is somebody else who questions it. So that's something great which probably hardly happens in any other institute, not only in this country but probably throughout the world.
To check gaps, if any, we have the ethics committee that conducts the mortality meetings to find reasons for a patient's death, a unique feature at CARE. CARE is striving for public trust and maintains medicine's humane and noble place among professions.
After I quit as a professor and head of the Department of Orthopedics in Nizams, I have been with CARE Hospital for the last 12 years. The unique thing of care is there is no unnecessary surgeries. So the indication is 200%. So second, the billing is highly transparent. No way any surgeon or any employee can take black money from the patient. These two things impressed me more than anything else when compared to other hospitals.
In a world racing for super specialities, we lay strong foundations to serve humanity with core values, to make healthcare affordable to all. CARE is taking a doctor to every village doorstep, providing urban healthcare in the remotest rural villages. Strong in ethics, CARE has reached the unreached, touching over 400 villages and 18 lakh population in Andhra Pradesh, Maharashtra and Odisha.
To anyone who does this with humility, courage and wisdom. And Harrison goes on to say, a physician means a doctor or healthcare professional today should ask of his destiny no more than this and should not be satisfied with anything less than this. So that is, those are the words which inspired us actually. And then many of my colleagues believe in it.
It is spearheading globally competitive healthcare services and related businesses, maintaining strong ethics, affordability, accessibility, sustainability, scalability and cost effectiveness to all. Therefore, there is care in every hospital now.